In childbirth, there are times even the best laid out plans can turn into a life or death situation. We'll be joining Dr. Nick Fanning, chiropractor and new father, who, as you'll soon learn, had his childbirth plans take an unexpected turn. Dr. Nick, I'm very glad you could join us today.
Kelly, thanks for the opportunity. I'm so excited to be here.
So, as I just mentioned, I know your plans for the birth of your daughter didn't go as expected. Can you elaborate just a little?
Absolutely. In fact, the first 2 trimesters went amazing. And here's the thing, as a chiropractor, the health alternative, especially, you want the dream birth.
Sure.
But my wife actually had a condition called placenta previa, which means her life would be technically at stake if she came to full term with our baby. And so we actually had to schedule a C-section a month beforehand. And the weird thing is we got closer and closer to that, 4 weeks even before that. So we're talking 8 weeks before her actually expected term of delivery, my wife went into labor.
Wow.
And there was blood everywhere. It was a really scary ordeal. I had to ride in the helicopter. And basically what happened is that she was going into labor. And so we had to actually life flight all the way to Denver. And so it's me and my new daughter in a plane trying to get to Denver, and then getting from the plane to the hospital was a whole ordeal. And so, man, we went from having a picture-perfect pregnancy at first 2 trimesters to an absolute, a scary nightmare towards the end.
Yeah. So when your wife went into labor, she still had to have the C-section?
Yeah, at that time, what they did is they had to do a C-section. And, I had worked my best to talk with them about how the C-section goes, because most people don't understand that the average, and this is actually a research study from the American Academy of Obstetricians, that with a C-section, that they pull about an average of 32 pounds. And if you imagine a little baby being 6 pounds, if we grabbed her by her head and dangled her in front of people would freak out. Well, that's only like 6 pounds of distraction. Take that times 6.
Ooh.
That's how much typically pulling on an infant's head can be. And I didn't want that kind of trauma anyway. And so that's what we were originally planning for. But yeah, she was delivered C-section and she was stabilized. And then that's when we took the flight for life to Denver.
Wow. Well, that sounds serious. So what was the condition of your baby?
Because she was so young and we're in a rural environment, we didn't have the benefit of having the materials that she needed to survive the next 8 weeks that a premature baby typically will take. Most premature babies are going to stay in a hospital setting like a NICU until they came to full term. So for my daughter Saffron, she had 8 weeks to be expected in the hospital.
Okay. Now, you being a chiropractor and in a hospital with concerns for your baby, were there conflicts in their methodologies?
My goodness, I felt like I was in the lion's den. So, I'm coming from a totally different paradigm, and there's nothing wrong with their paradigm. They only had good intentions.
Sure.
They wanted to save the life of my daughter, and I was willing to do that. But here, there were some caveats to that. And so, for example, when you're in that kind of setting, they try to bully you around, with their expertise and things like that.
Yeah.
And you, as a parent, you need to stay strong. You have to make sure that your opinion matters. And especially as a healthcare professional, I wasn't totally ignorant of what was trying to be done. But at the same time, that's why I'm so passionate about empowering my patients to stick up for their health and make their own healthcare decisions. Because once you start having that taken away and you get their fingers poking your face, man, it goes downhill fast. For example, I had a doctor actually try to tell me that the body wasn't smart enough to put enough calcium in breast milk so that my daughter could grow from that. We all know better. We all know better. That was such a ridiculous statement.
Sure.
In fact, when I asked her, I was like, well, great, where did you read that, and can I have a copy of it? She was dumbfounded. She couldn't back it up. And her whole intent was trying to get my daughter on formula. And it wasn't going to happen. We all know breast milk is best.
Sure we do.
So that's just one example of many.
So were you able to adjust your baby in the hospital? And if so, how soon?
Well, I don't technically have a Colorado license. So technically I wasn't allowed to. But the way I saw it is that this is my daughter and I'm in control. So in fact, I didn't have a hospital privilege, and so there would be no way that under circumstance I could actually adjust my daughter legally. Now, that being said, I could still hold her, and there's a technique called kangarooing, which has been shown to have immense benefits with babies. It's basically skin-on-skin contact, and when you just hold them, and you can hold them as long as you want, as long as they're skin-on-skin contact. Now, as I'm doing that, of course, I've had so much experience, I couldn't help but check her for subluxation and correct that. And you would just be amazed at what happened with that. She would get off her tubes the fastest. She got off her IV line. She was breathing better. She got off her bilirubin lights so much faster than all the other babies in her ward. And guess what? She was put in a room with the same situation with other babies. And she, time and time again, outperformed every other baby in there.
Awesome. And did they ever question why or give an explanation as to why your baby was doing so well as opposed to the other babies.
They had no idea. In fact, I used that opportunity to educate the nurses, and the nurses were all on board for that. They were like, well, hey, you need to be adjusting your daughter and blah, blah, blah. And they're like, it's too bad that you can't adjust everybody else too, because the nurses get it. They understand that the central nervous system is so important, but the doctors were dumbfounded. And in fact, most of the nurses had no idea. They were just like, wow, I'm so surprised little Saffron's doing so well. And then it would use that as an opportunity to say, well, honestly, I'm doing this. So it was just one after the other.
Okay, and now how old is your daughter now?
She is 13 and a half months.
Great.
And you would be amazed at the way this little girl has progressed. And in fact, when I talked about earlier about it being 8 weeks for her to be expected to leave, she actually left in 6 weeks. Great. She fed better than most other babies. She latched, she took a full feeding, and she's sleeping through the night so perfectly that we actually got to go home early. And ever since then, it's just been an absolute joy seeing this kid thrive. Now, standard medical literature would say that it takes a premature baby 2 years to be caught up neurologically, birth weight, height, everything, because they're so far behind. But you know what? As we were getting her and healthier and adjusting her and breastfeeding her and doing all the things that we knew that her body needed, at her 6-month checkup, completely caught up. Awesome. 90th percentile for height. 60th percentile for weight, which I gotta be honest, in America, that's probably a good thing. But reflex is the same. She was doing the appropriate signs at 6 months, and I couldn't be happier.
Excellent. How often were you adjusting your new daughter?
It was every time I held her, which, as an overprotective father, I was just checking her all the time.
Of course.
And so, I was just checking her. It wasn't that I was adjusting her, I was just checking her. Because you know what? Like I said, the body's intelligent, and it would hold their adjustment in some things, and then sometimes it wouldn't. It would be all dependent on the stress that she's going under, too.
Sure.
And so it might have been once a day at certain times. It may have been, every couple of days on other times. It really depended on where she was struggling and how she was doing.
So, were there any conflicts in regards to medications?
At the very, very beginning, oh man, we fought. At first, it was standard procedure that you'd be placed on an antibiotic because they weren't sure what caused her to go into labor. And sometimes it can be infection, which can be dangerous. And so they automatically assumed because she was life flighted over there, and because she made it to the hospital before I couldn't say no. So when I got there, it took me about 2 hours, but we got her off the antibiotics because we knew better. We knew it wasn't an infection. In fact, my wife was perfectly fine too. And that was one of those big things that we knocked heads about. And you have to you really need to stand up for your own right. And you have to stand up for your right for health care.
Yep. Look, we're running out of time, but what message would you like to leave for parents or parents to be?
It's something like this that really concreted my faith in chiropractic. I've seen so many miracles, but it's until it's your child, man, there's nothing more precious than your child. But until it's your child, man, it just changes everything. So what I would say for any parent that's struggling with like failure to thrive, or with a premature baby, or with a baby that just seems to be doing as well as the other babies, there's a chance for a normal life for them. If you start checking those things, and I'm sure that like any parent, they're trying to do exactly what's best for their child. Sure. They may have thought of everything under the sun and perhaps never even thought about chiropractic. And that's why I'm encouraging all practice members and people alike to really go out of their comfort zone and talk to these parents, because it might be an option they never even considered. Yep. There is that chance for a normal life. They just have to get it checked.
Thank you so much, Dr. Nick, for taking the time and joining us today.
Kelly, thanks so much for the opportunity to talk to and tell my story with my own daughter. I hope it empowers at least one person to go outside their comfort zone and help get some babies checked and give them that opportunity for a normal life.
Oh yeah, again, thank you, Dr. Nick. I hope you take Dr. Nick's story to heart and share it with those around you. Just think of the difference you can make in a child's early life.